You know how there is a trend or increasing pressure rather to be independent, self-sufficient, to be able to do things alone by yourself and also have fun doing that? But it's perfectly all right if you have trouble doing all of that, if you feel lonely, because you are not alone in feeling that way. A lot of people are in the same boat, so much so that the World Health Organization has now declared loneliness a global public health concern. The COVID-19 pandemic halted all social activity. People were not able to see their friends and loved ones. Neither could they go out to grab a coffee. Students graduated without meeting their classmates in person. There was no hanging out outside college or enjoying light banter with colleagues before getting to work. Simple pleasures of life became a luxury. And the levels of loneliness skyrocketed across the world. Having gone through all of that, there is rising awareness around the issue of loneliness and also the importance of socializing. The World Health Organization has launched an international commission on social connection. Let me just tell you a little bit about it. The commission will run for 3 years from 2024 to 2026. The team of 11 advocates and ministers will be led by US Surgeon General and the African Union Youth Envoy. Together, the commissioners aim to find solutions to reduce social isolation and loneliness. But what prompted the World Health Organization to take this decision? Simply put, the extent of the issue. We might just shrug off loneliness and wait for that emotion to pass. But should you be doing that? Seeing its adverse impact on health, I would advise you otherwise. Medical experts equate the mortality effects of loneliness to smoking 15 cigarettes a day. 15 cigarettes a day. That's how bad loneliness is for your health. The stress that your body and mind experience would be the same as smoking 15 cigarettes. Loneliness also puts you more at risk of diseases. Studies have found that lonely adults are 50% more likely to develop dementia. Risk of incident coronary artery disease or stroke also increases by 30% due to loneliness. And these are just the physical effects. Emotional effects run a lot deeper. But all of this could be eliminated simply by interacting more with your peers. While loneliness is often seen as a problem for developed countries, US Surgeon General saying the rates of social isolation are more or less similar in all regions of the world. How widespread is the issue really? Let me tell you. 1 in 4 older adults struggle with loneliness, and it's not just the elderly. Social isolation knows no age or boundaries. Between 5% and 15% of adolescents across the world are lonely. In Africa, 12.7% adolescents experience loneliness. The situation is a little better in Europe, with 5.3% adolescents feeling lonely. You see, no matter what the general opinion is, we cannot underestimate loneliness. And as ironic as it may sound, loneliness does not exist in isolation. It creates ripples in all aspects of your life. Youngsters experiencing loneliness at school are more likely to drop out of university. It can also lead to poorer economic outcomes. Feeling disconnected and unsupported at work can lead to poorer job satisfaction and performance levels. WION now available in your country. Download the app now. Get all the updates on the move.